Here we have a left clavicle. It is an S-shaped bone, with this being on the medial side, it's the sternal end, and this is the lateral side, which is the acromion end. This appendicular bone is a right scapula. This is the medial border, this is the lateral border, and this is the superior border. This is the inferior angle, and this is the superior angle. This is the spine, and this is the coracoid process, the acromion process, the suprascapular notch. The infraspinous fossa goes all the way through here, underneath the spine, and the supraspinous fossa goes all the way through here, above the spine. And this is the glenoid fossa, and this is the subscapular fossa, which is on the anterior side of the scapula. Here we have a right humerus. This is the head, this is the anatomical neck, this is the surgical neck, which goes all the way around, this is the greater tubercle, the lesser tubercle, and the intertubercular groove, which goes right in between. This is the deltoid tuberosity, this is the medial epicondyle, the lateral epicondyle, the trochlea, the capitulum, the coronoid fossa, the radial fossa, and the olecranon fossa. This lateral forearm bone is a left radius. This is the head, this is the neck, this is the radial tuberosity, and this is the styloid process, which points to your thumb. This medial forearm bone is the left ulna. This is the trochlear notch. This is the radial notch. This is the olecranon process. This is the coronoid process. This is the head, and this is the styloid process that points to your pinky. Here we have a right hand. These are the carpals. This is the scaphoid, lunate, triquetral, pisiform, trapezium, trapezoid, capitate, and hamate. This is the scaphoid, the pisiform, and the hamate. These are the metacarpals. They are numbered from lateral to medial, being 1, 2, 3, 4, 5. This is the head of the metacarpal, and this is the base. The phalanges are all of these, and they are also numbered lateral to medial. This is the proximal phalange of the second phalanx. This is the middle phalange of the second phalanx, and this is the distal phalange of the second phalanx. The difference between the thumb and the rest of the fingers is that it does not have a middle phalange. Here we have a left pelvic bone. This anterior and posterior superior area is the ilium. This inferior posterior area is the ischium. This inferior anterior area is the pubis. Here we have the iliac crest, the anterior superior iliac spine, the anterior inferior iliac spine, the acetabulum, the superior ramus, the inferior ramus, the obturator foramen, the pubic symphysis, the ischial ramus, ischial tuberosity, lesser sciatic notch, greater sciatic notch, ischial spine, posterior inferior iliac spine, and posterior superior iliac spine. And all of this is the iliac crest. Here we have a right femur. This is the head, this is the neck, This is the greater trochanter. This is the lesser trochanter. This is the intertrochanteric crest, and this is the intertrochanteric line. This is the gluteal tuberosity, the linea aspera. This is the lateral epicondyle, the medial epicondyle, the medial condyle, and lateral condyle. This is the intercondylar fossa. This is the patellar surface. This is a patella. To find out if it's a right or left, you lay it on a table facing away from you, and whichever way it falls determines what it is. This is a right patella. This is the base of the patella, and this is the apex. The medial lower leg bone in my leg is the left tibia. This is the lateral condyle, the medial condyle, the intercondylar eminence, the anterior crest, the medial malleolus, and the tibial tuberosity. Here we have a fibula. It is the lateral lower leg bone. This is the proximal end, and this is the distal end. Here's the head, the neck, the shaft, and the lateral malleolus. This is a right foot. These are the tarsals, the calcaneus, the talus, the navicular, the cuboid, and the three cuneiforms. These are the metatarsals. They are numbered from medial to lateral, 1 through 5. This is the head, and this is the base of the metatarsals. These are the phalanges. They have a proximal, middle, and distal, except for the hallux, which has just a proximal and distal. This is the medial longitudinal arch, this is the lateral longitudinal arch, and this is the transverse arch. The loose tarsals that we have would be the navicular, the calcaneus, and the talus.